Welcome to In the Community with Tiffany K.
And we're back with another In the Community. I'm Tiffany K. And today I have the Rappahannock Area Health District here with me. I have Erin, who is the COVID-19 Response Team Coordinator, and Allison, who is the Population Health Manager. How are you ladies doing this morning?
Good, thanks. How are you?
I'm doing great, and I'm excited to be discussing with you this morning all about, especially having flu season around, all about the illnesses in the area, what we can do to prevent them, and what we need to know as a community. So let's just jump right in, shall we?
Sounds great.
Awesome. Well, Allison, I'll start with you. Let's talk a little bit about the Rappahannock Area Health District. What are some of the services we can look at? What do we need to know? Kind of give me the rundown.
Sure. So the Rappahannock Area Health District is the local health department that serves Fredericksburg, as well as Stafford, Spotsylvania, Caroline, and King George.
Okay.
So kind of this Fredericksburg region area.
Yeah.
We do operate the local health department. So, when people think of a health department, I think sometimes they think of like a place you could get immunizations.
Yep.
It really depends on like what your role in the community is. But if you're, somebody who does construction, you might be thinking that we do septic permitting, because that is something we do, and we can talk a little bit more about that. But really at its core, a health department is about ensuring that our community has the conditions where everybody can be healthy. So you'll see that we care about septic permitting because obviously we don't want sewage
right.
floating around in our community. That would not be good for people's health.
No, thank you.
Exactly. But that's also why we do something like immunizations, because this is something that protects not just the individual, but the community as a whole.
Okay.
So that's kind of what sets us a little bit apart from, just your average healthcare provider. We're also a government entity, so of course that's going to be a little bit different as well.
Right.
But that's kind of really the core of what we do. And we can get a little bit more into services. I don't know, Erin, if you want to talk through some of those initially, and we can
sure.
tag team that.
So I think like Allison had mentioned, a lot of people think of us as like clinical services, which we do provide a pretty big variety of those. We've got things like children and adult immunizations. It runs like a full gamut. Flu shots, COVID is, something that has been really in the news for the last several years. And I think that's what most people think of when they think of the health department.
Yep.
But we also provide things like sexually transmitted infection screening and treatment for a variety of illnesses there. We have family planning services for women who need access to birth control and other things along those lines. We've got the Every Woman's Life program, which is really great, especially here in January. It's Cervical Cancer Awareness Month. Okay. And they provide breast and cervical cancer screenings for women who have no or very limited health insurance.
Oh, wow.
So that's a great program, especially in the month of January and in October when we think about breast cancer awareness. We've also got WIC for women, infants, and children, where it provides some supplemental assistance to access healthy foods for those individuals. And then we also do things like vital records, copies of death and birth certificates for family members of the newly born or recently deceased. Additionally, in our environmental health, that's where the food service program lies, but we've also got the on-site, septic and well permit inspections and construction. They review plans for those construction items. And then we do a lot with our rabies control program.
Oh, wow.
Where if we have a wild animal who's come in contact with a domestic animal or an individual, we provide guidance and observe animal for, a couple of days, make sure that they're not rabid at the time that they bit the individual.
And where can people go to get, because you said that's a very general look at it.
Yes.
And I wish we had all the time in the world to talk about it. But where can people go to get more information about what you all do?
So our website, I don't have the exact website.
I do. It's vdh.virginia.gov/Rappahannock.
Okay.
Yeah.
Perfect. And that's where they can get all the information, whatever they need, questions answered as well.
Absolutely. We also have social media platforms. We're on Facebook, we're on Instagram and X, what used to be Twitter.
Right.
And we also have a call center that is operated during business hours from about 9 a.m. to about 3 p.m. each day that we're open, and that's 540-899-4797. If they hit option 0, they'll be able to either leave a message or speak with our call center representative who can redirect their call or answer their question directly.
Oh, perfect. Okay, well, I'm speaking with Erin and Allison, part of the Rappahannock Area Health District. I kind of want to jump into what's on the top of people's minds right now, and it is flu season, cold season, respiratory illness season. And so can you tell me a little bit about what we need to be looking towards happening during the season this year? What are the, numbers that we're going to see? How do we stay safe from all of that? What is all that?
Yeah, sure. So I can speak to this. So I think this is at the top of everybody's minds because I think everybody knows somebody who's been really sick lately with some kind of respiratory illness. A lot of flu going around. Flu symptoms can look really similar to COVID symptoms. So I think some people have had COVID. It's gotten a little bit better with RSV, but this is the third one that we kind of look at in this mix. But that appears to have kind of peaked and come down a little bit. But we'll start with flu.
Okay.
So flu in Virginia, including in our region, is at what's considered to be very high flu activity level. So we have categorizations of where we put
right
flu activity, and very high is the highest.
Oh, geez.
When we look at kind of graphs over the last few years, we're really at a peak right now. It is really going around. We'll kind of talk what this means.
Right.
This is the time of year where we see flu. So this isn't like totally alarming that we're seeing this. Like
exactly.
Winter months are when this goes around, when people get sick. I know especially when people have like kids in daycare, kids in school, or like, older family members who are in, maybe a nursing home. I think that's when people really perk up about this, and you'll start to hear it. Like these congregate settings are where it really spreads. But it is looking really high right now. The way that we know that it's really high, there's a few different metrics we look at, but one of the best ones is just like who is showing up at emergency rooms and urgent care centers.
Oh, okay.
And so the more people that are coming with these like flu-like symptoms,
right.
That's one of the ways that we're looking at this. So over 7%, almost 8% of the people going to emergency rooms and urgent care centers right now are going for something that looks like flu. That doesn't mean that those are all the people who have the flu right now. Because a lot of people can heal from the flu at home. You need extra rest, you need extra fluids. If you're not in, one of the higher risk groups, like the very young or very old,
right.
you're probably going to stay home. But we do see that peak when it's really circulating, and that's what we're seeing right now.
Honestly, I was one of those numbers probably you saw in urgent care a couple of times. So I get what you're saying. Like, and it's kind of sad because when you do have kids, a lot of times, of course, they're around other kids. And I don't have kids, but my friends do. And so every time, like, I get the flu, I'm like, it's because of your kids.
Yes.
You're like, I don't want to be around it. But that's something to be aware of. It really is.
It is.
And to stay home from work if you are sick because you don't want to pass it on to anybody else.
Yeah, exactly. And, I know... I kind of joke, we're all in this place where we're really ready to move on from COVID-19, but there's a few things I want people to remember, and they are, if you're sick, stay home. Like, during COVID, we were all really good about this because we were so worried about it, but, like, it's just a good practice. If you have the ability to stay home when you're sick, that's what you should do. Like, the days of where you're like, I just have a mild cold, I'm still going to go in. I really want us to try to move past that. I know sometimes it's not possible. Like, maybe you're feeling sick, but, like, your kid still needs to go to school. You got to do that drop-off. I understand, but try to take those precautions. Masking is still an option. So sometimes I think when you see people wearing a mask, maybe they're just getting over something, or maybe they're just more vulnerable to disease, and that's why they're wearing a mask. But that can be a good way to keep others around you safe. So number one thing from COVID, stay home if you're sick. The number two thing is washing your hands.
Yes.
And I don't know if you remember, like, March 2020, everybody was like, I have to wash my hands so much. But, like, they should have been washing their hands all along.
I agree. You know what? When that came out, I was like, aren't we all supposed to be washing our hands already? I'm just a little confused.
Yes, exactly. So that's the other thing I want people to remember. Washing your hands, not just like a little rinse, but like thoroughly washing your hands, 20 seconds, using soap and water.
Sing the ABCs.
Exactly. Happy birthday twice.
Yes.
Something that, you can do. But that's just a really good principle to help keep people around you healthy. Carrying hand sanitizer can also be great. Things like, covering your mouth when you sneeze and cough. Like, these aren't groundbreaking things. They're things that I think everybody knows, but just really remembering them this time of year can help keep yourself healthy and also the people around you healthy.
And I think it's a mentality shift, right? Like, you're so used to being okay with just doing your same old thing. Oh, I have to go to work because you have to fight through it. You're just not used to taking that break for yourself. Yeah. And honestly, using common sense.
Yeah.
So
Exactly.
Common sense isn't common anymore, unfortunately.
Exactly. And we're all so busy. Like, I know everybody's rushed, but it's really gonna take up a lot more of your time if you get down and out with the flu or with COVID or with, one of these respiratory illnesses that are going around.
Right. So be safe.
Yes, exactly.
Okay, so let's move on a little bit to RSV, which is also a big illness happening during this time.
Yeah, and so RSV, we really saw that the peak of RSV was in October, but there are still cases circulating. The big news this year with RSV is that this is the first year that we have a vaccine for RSV.
Oh, wow.
So unlike, flu and COVID, which, to take us back to flu, like, highly recommend everybody getting the flu vaccine, being up to date on your COVID vaccines. It's not too late to get those vaccines. When we're looking at RSV, the vaccines are really for those groups that are more at risk, and that's for RSV, very young infants as well as older adults.
Okay.
I think people kind of know about this risk, especially for really young children, because you do hear about a lot of hospitalizations. There is a treatment available. It's sort of a vaccine in that it's an injection, but it's actually some antibody protection. So, like, if you're getting into the nuances of what this looks like, but it is a treatment that can prevent RSV for infants.
Okay.
Unfortunately, there's been very limited supply for this year, but if you do have a really young child, especially one who you might have another condition that puts them at increased risk, definitely something to ask your doctor about.
Okay.
For older adults, there is a vaccine available. So if you're 60 and up, again, this is just a good conversation to have with your doctor.
Yeah.
Especially if you have another condition that, might put your immune system at risk, or if you're like undergoing cancer treatment, or if you just have some chronic illness that increases your risk, something certainly to consider. And those are pretty widely available for older adults. I think you can get them at many pharmacies right now.
Okay.
So much more available. And then the third group that is at risk that can get the RSV vaccine is pregnant women. Benefit to this is that it does provide some protection to your baby once your baby's born. So if you're kind of approaching your due date and we're still in this respiratory illness season, I think really something to consider. Pregnant women are recommended to get other vaccines towards the end of their pregnancy. And so this is something you can kind of tack on there. So again, good conversation to have with your provider. That goes above and beyond these like behavioral washing our hands practices.
Right.
Looking at some of those vaccines.
And keeping yourself safe in general.
Exactly.
And the other one I want to talk about, and I know we talked about it for a while, but we still got to keep talking about it. It is respiratory illness season, and we got to talk about COVID a little bit.
Yes.
I just, I know people are probably tired of hearing about it. It's been how many years now, but it's still important to be aware of. It's still happening, and what do we see in the trends that are happening with that? And also, how can we stay safe?
Sure. So again, COVID-19 cases have been going up. We do still see deaths due to COVID-19. We talk about it a little bit more now in the context of flu because they can look really similar. Having fever, chills, body aches, sore throat, cough, like those can be either one. I think it's still a good idea to have COVID tests on hand. You can still order them for free through the government. So I encourage people to take advantage of that. Like, why buy something that you can get mailed directly to you at no cost? COVID-19, the biggest distinction in my mind between, flu and RSV and COVID is that COVID is really the biggest risk for those older adult groups.
Okay.
We recommend everybody 6 months and up be up to date on their COVID vaccines. So, there was a new booster released a few months ago. If you haven't gotten that, it's definitely something to consider. Again, widely available at pharmacies, also available at the health department. So especially if you don't have insurance or, maybe don't have really comprehensive insurance, health department is a really good place to consider because it's probably going to be lower cost there.
Okay.
But key takeaways, it's still going around. And especially if you're an older adult or somebody with another pre-existing condition, something that can put you at high risk, and it's good to be on the lookout.
And those are just some of the things to be aware of. There's, of course, other illnesses going around, but those are the big ones for this season.
Always.
Yes.
But when we talk about like respiratory illnesses in the winter, those are the big ones we see. This is often a time of year where we see it not just because it's cold outside, but we've all just like been around a bunch of people indoors.
Right.
A lot of people traveled for the holidays. So it's just kind of like this perfect storm for stuff to be circulating and people to get sick.
I'm speaking with Erin and Allison of the Rappahannock Area Health District. Now, let's move on a little bit and talk about what are some of the Rappahannock Area Health District's other priorities heading into 2024.
Yeah, so we're working on a lot of messaging this month and next month on social connectedness.
Okay.
We're looking at how keeping those social connections and seeing people, whether it be face to face in person or even face to face through a video call, rather than, just a text or an email or something, but really having that like social connection to another individual, having friends and family that you can talk to, how that impacts your health. So we're doing a series of messaging on our Facebook and Instagram pages related to that. We're working with some other organizations, especially in the Fredericksburg area, about that. So we're really excited to talk, social connectedness over the next couple of weeks here.
I think that's important, especially those who have mental health.
Absolutely.
Things that they're dealing with. I'm one, I know a lot of people are, and there's nothing better than a good support system.
Absolutely. I think COVID-19 really highlighted how fragile we are without social connectedness. And I think this is a really good time to bring some of that messaging back.
And where exactly are you said that's happening on the Facebook page?
Yeah, a lot of that messaging is going to be up on our Facebook and our Instagram pages primarily.
Okay. And what do you think is one of the biggest things that people need to take away from that social connectedness?
I just think that it plays such a big part in your physical and mental health. And it can really, it can lower your risk for some physical illnesses and ailments if you have a good, support system and connections to others in your community.
And as you said, it can even be video chat.
Yeah, I have a good best friend who lives in Pittsburgh. I don't get to see her very often, but I would much rather see her through a computer screen than not see her at all. So we set up video calls every once in a while, and it's better than, the texts and the emails. It's a little more in-depth and personal.
Right. Those are important things. Like I said, I'm from the mental health community too, so I understand exactly what you're saying. Is there anything that you wanted to add, Allison?
Yeah, I mean, I think that my biggest takeaway, as the health department is starting to talk about this, as Erin said, when we don't have as much connectedness, this can have real impacts on our actual physical health, increased risk of heart disease, but it can also make you more susceptible to things like viruses and respiratory illnesses, which feels hard to wrap your mind around that, if you're staying at home to avoid getting these things, and you're not talking to people, that can also put you at risk as if you're out in the community. So to me, one of the biggest takeaways that I want people to carry with them is to just try this month to maybe do one extra thing that is going to keep them connected. Maybe reach out to one extra friend, see if they want to go for a walk, grab a cup of coffee, whatever your thing is, go do it with them. Or it can just look at if your family usually eats dinner in front of the TV because you're so tired at the end of the day, maybe just turn off the TV, put away the devices, and have a family dinner together for 30 minutes. Just take one little step as you're doing all your New Year's resolutions of connecting with those that you care about.
And I'm always a big believer that when you take care of yourself, you're able to help take care of others. And part of that is that social aspect as well. As you said, you can actually get sick from not being around people as well. I mean, there's been times I've been in a depressive mood, and I'm then you're able to get sick quicker, you know, because you're not doing things with other people. You're not at least engaging in some way.
Yeah, totally. And I think that's when you bring that up, it's such a good point. And it highlights that I think this is something that we all know. We know it's good to connect with people.
Yep.
Sometimes we just don't do it. And so taking that step to just do it just a little bit more, not asking that you clear your entire schedule
right
to do all these social things. But just
I can't come to work anymore.
Right,
I gotta go do this.
I gotta get my social connectedness in. No, but just finding little ways to do it, I think, can really enhance your quality of life. But again, also have these positive impacts on your health.
And definitely, I think one of the biggest things is it's the idea of self-care, right? So if you had your goal for 2024 was to have more self-care doesn't have to be sitting in a bathtub. It can be, but it doesn't have to be. That's great. Trust me.
Correct. And it also doesn't have to be about spending money. I think sometimes people get tied up in self-care, I have to go get a pedicure. No, there's lots of free things that you can do for self-care.
Exactly.
It might just be, taking the time to do it.
Well, I'm speaking with Erin and Allison with the Rappahannock Area Health District. We've been talking a lot about different illnesses going around, preventative measures. Is there anything else going into 2024 that we're looking ahead to?
Sure. So one of the other big things that's been happening at the health department, we didn't talk about this when we were talking about services because this isn't necessarily a service people would come to the health department for.
Okay.
But a year or two ago, we completed a pretty comprehensive community health assessment. We did it in partnership with Mary Washington Healthcare. We worked with about 70 other organizations just to look at what does the data say for health, about health in our area? what do different cancer rates look like? What do asthma rates look like in our area? Those types of things. But we also got a lot of community feedback for this process, asking people like, what are you most concerned about when it comes to health in our community? We took all that data and then we kind of presented it back to the community of like, these are some of the things that we think we see that are a little bit concerning for our area. What would you like us to work on? So born out of that is what's known as the Community Health Improvement Plan. So again, this has been in place for a little while, but still really remains a priority for us. And a lot of other nonprofits and government entities that we work with have some priorities in this. So there's some strategies, The 3 priorities that we heard back from the community were mental health, which, one of those reasons why we're doing this kind of connectedness campaign. And then also affordable housing and access to healthcare. So a lot of the newer things that the health department is doing are tied to these 3 issues. Or we're trying to partner with other organizations to kind of build some support around them. So we've talked a little bit about mental health. There's some really great resources out there related to mental health in our area. CSB does some great things. Mental Health America has a pretty comprehensive helpline where if you are looking to find a mental health provider, they can help you find one who accepts your insurance and is accepting new clients, which is really key right now. So those are some of the things happening around mental health. But I'll talk a little bit more about affordable housing and access to healthcare, especially because affordable housing, I think people are like, how is this related to health?
I was just going to say, that's not necessarily coming top of mind when we're talking about this.
Yeah. But I think it's something that people know is an issue in our area. Like, it's definitely become a lot more expensive. Mortgage rates are really high. There's just not a lot of homes on the market, and there's all these different impacts.
Even just rent and apartments are extremely high.
Yeah. I mean, even compared to like 5 years ago, like it's really skyrocketed. Affordable housing is what we call a social determinant of health. And so this is something that, isn't like an infectious disease going around, but it's something that we know contributes to health on the whole. So this kind of ties back to this notion in public health where we think that your zip code can actually determine more of your health outcomes than your genetic code. And so where you live, and if you can afford housing there, is important because where you live affects the safety of the area that you live in. So do you live in an area with high crime, or do you live in an area where you're like on a really busy road and there's really high number of traffic accidents? That's something that can impact your health. The house itself, like, does your house have mold? That's something that can impact your respiratory illness. But also the amount that you're paying for housing, if you're considered to be cost burdened for your housing, where you're paying more than 30% of your income on your rent or your mortgage, it means you don't have as much money for other things, not just health insurance, but also things like healthy food. Like healthy food is more expensive than kind of unhealthy junky food.
McDonald's.
So affordable housing is kind of like the root of all of this. And because it's become such a problem here, that's where we've taken some collaboration. Health department is by no means like providing affordable housing, but we've just been trying to generate some more conversation around this. So the most exciting thing that happened in this space was that in October there was a housing summit that George Washington Regional Commission coordinated. It had 200 people in attendance just to learn more about this in our area. Like, oh wow! In spite of, I think, individual community members being aware of this, there wasn't like a really collective conversation. And so that's something that's kind of spurned out of the Community Health Improvement Plan. And we're hoping that there will be some more kind of exciting next steps to come in addressing that. So that's been one of our priorities.
And I think the biggest thing there is just being educated. Yeah. Just get educated to see how you can help in the end.
Right, exactly. And like, there are solutions. It's kind of a complex issue, but like step one is, as you said, being educated, understanding what those might be, and thinking about like what might work for our community. Because what works for like New York City is definitely not going to be what works for Spotsylvania County.
Exactly.
And so we have to figure out those solutions to benefit our community and ultimately like the health of individuals in our community.
We're getting some great information today because honestly, if you look back on this whole conversation, we're realizing just every single thing can affect your health.
Totally.
And even if you're not thinking, as you said, affordable housing, not the first thing that comes to mind when you think about it, but now that you explain it that way, it's important to recognize your surroundings and what's going on in your life to see how it is affecting your health as well, because health is probably the most important thing that you have to yourself.
Yeah, and I actually think that this was a big lesson learned from COVID. Like early on in COVID especially, like we saw that when our health becomes destabilized, like everything came crumbling down.
Yep.
Like the economy, our social connections, like everything else started to fall apart because health is not the only thing, but is certainly very foundational to our communities. And so I like to continue to have those conversations with people just so that we can continue to see that it's not just about like going to the doctor's office.
Right.
There's a lot more that goes into your health.
So especially so we don't repeat history. As
Totally.
well.
Yes, that would be
you
the
know,
goal.
that'd be nice.
Yeah.
And I know you had one more point with that.
Yeah, and so the last priority in the community health improvement plan is access to healthcare. And so I think that this is a little bit more when people think about health, they're thinking about their doctor's office,
right.
the hospital system, those sorts of places. But we know that a lot of people don't have enough access to that. We know that in our area, there's even if you have good insurance, it can be hard to get a primary care provider. It's just a little bit of a shortage, especially in the counties. Like the city of Fredericksburg has quite a few providers, but as we get into the counties that we serve, it can be hard to be connected to a provider and develop a relationship with them.
Right.
And in our more rural areas, even more so. Like in Caroline County and King George, we see that there's very few primary care providers serving that area.
Okay.
And that's for people who have insurance. And then we have people who, maybe don't have very good insurance or very comprehensive insurance, or people who don't have any insurance at all. Healthcare can be really challenging. This can also include things like, how do you get to your healthcare? Like maybe you have Medicare and you feel like your insurance is pretty good, but like you don't drive anymore.
Right.
And like we're in a community where it's pretty hard to get around if you don't have a car. So this aspect of the community health improvement plan is really about improving people's access to that care. So this includes, there's some strategies through Healthy Generations Area on Aging, where they can do some training of how to use public transit systems. So if that's something that could apply to you, that's a resource that's out there and expanding. The health department is doing health literacy training.
Oh, okay.
We've especially been doing this with older adults and also refugees who, may be really unfamiliar with our health system here.
Yeah.
And so we go over some very basic things of like, when would you go to urgent care versus when would you go to the emergency room? Because one of those is a lot more expensive than the other. They may be able to meet your need. And then the last thing I'll talk about that the health department specifically is doing about access to care is we have developed we're calling it our assistance form. So on our website, there is a place you can go if you have a need and you're just not sure how to get it met. So this could be like, my health isn't good because I don't have access to food. So you can fill out this assistance form and we'll have somebody from our team call you and we can try to help connect you to some community resources that are out there.
Oh, wow.
This could also include things like housing, transportation, all those sorts of things. But that's another way, rather than people just trying to do a Google search and not being quite sure where to go, now that we feel like we've developed pretty good relationships with organizations, we can help connect you to them.
Okay.
So it's kind of a new, exciting thing for the health department that's there.
And what's the website again?
vdh.virginia.gov/Rappahannock.
Awesome. Well, thank you so much, both Erin and Allison, for being here with me today with the Rappahannock Area Health District. And that'll do it for In the Community this week. If you are a nonprofit and need to bring attention to your cause or organization, please reach out through this station's website, and we will see you next week.